Diabetes is a rapidly growing medical problem in Canada. We have the third highest rate of type 1 diabetes in the world for children under the age of 14, and the number of newly diagnosed children is rising at a rate of 3 to 5% every year. Perhaps you have a student in your school with type 1 diabetes and wonder what it means to you as an educator. A student with type 1 diabetes looks like any other student, that is, their condition is not visible. They can live active, normal lifestyles. However, they do need some accommodations in the classroom, and there may be instances when they will need your help. Because children spend a large part of their day at school, it's important that the adults working with them understand what type 1 diabetes is and how best to support them. Students with type 1 diabetes quickly learn to perform many of the tasks involved in taking care of their diabetes, simply because they must do these things many times a day, every day. However, they can only stay safe at school if they have the support and understanding of all school staff.
My name is Ramon. I'm 12. I developed type 1 diabetes when I was 4. I learned to check my blood sugar pretty easily. It hurt at first, but now I just do it. My mom and dad used to give me all my insulin needles, but now I wear an insulin pump. I can give myself insulin much easier using it. I know I'll have to live with diabetes till they find a cure for it. And I know that I have to do a few extra things that other kids don't. But I can pretty much do everything and anything I want to do.
More than 200,000 Canadians have type 1 diabetes. It is an autoimmune disease. This means that the body's immune system has destroyed the insulin-producing cells of the pancreas. A student with type 1 diabetes no longer makes enough of their own insulin to stay healthy. Everyone's body needs insulin. It is a hormone that allows most of the food we eat to enter the cells of our body as an energy source. Without insulin, our body would literally starve. Children with diabetes must take injected insulin and monitor their blood sugar levels several times a day.
What causes type 1 diabetes to develop is not well understood. There is a genetic component, so if a mother or father has type 1 diabetes, their child is at increased risk of developing the disease. However, that's only part of the answer. There is about a 1 in 250 to 400 chance that a child without any family history will develop type 1 diabetes. This translates into about 1 student per elementary school who must live with the disease. It can be hard being the only student in the school with diabetes, so it's important that school staff understand the basics of type 1 diabetes so they can properly support that student.
So this is your insulin pump?
Yeah, so when I have to bolus, I press this, and then I put in the insulin, it goes through, and then it goes inside me.
People have many misconceptions about type 1 diabetes and often mix it up with type 2 diabetes, which is a very different disease process. A child who develops type 1 diabetes could not have prevented it. It's not because they ate the wrong foods or because they're overweight. Neither is it contagious. Type 1 diabetes is something that happens to a person and we don't understand why. Because the insulin-producing cells of the body have been destroyed, insulin must be injected. But unfortunately, insulin is not a cure for type 1 diabetes. It's a discovery that allows people with diabetes to control their condition. There are basically 3 things a student with type 1 diabetes must try to balance to keep their blood sugars in range. These are food, insulin, and exercise. However, blood sugars may also be affected by factors that we cannot control, such as stress, illness, growth, changes in temperature, to name a few. So it can be very challenging to keep blood sugars where they should be, in spite of the best efforts.
Helping keep a student with type 1 diabetes safe at school means that all school staff should know which student has diabetes, what a low blood sugar is, and how to respond to it. A student who is experiencing a low blood sugar is in a very vulnerable state. Staff need to be able to identify when that student is having a low blood sugar and respond quickly and appropriately to help that student.
Naomi, are you feeling okay?
I feel a little low.
Where's your blood testing kit? Here you go.
An important component of keeping a student with diabetes safe is developing a school diabetes plan. This plan needs to be customized to the individual needs of the student. The student's parents are your best resource for doing this. The plan should clearly identify the symptoms the student will develop when they are having a low blood sugar and the action required to treat it.
So what is a low blood sugar, or as it's also called, a hypoglycemic reaction? Essentially, it means that the level of sugar present in the blood is inadequate for normal brain function. When the brain detects that the blood sugar level is too low, it sends cues or signs to the student to alert them. On the student's school plan, there should be a description of how the student feels when they are low. Every student will have their own unique signs and symptoms of being low. The most common include intense hunger, shakiness or jelly knees, sweating, paleness, extreme tiredness, quietness, headache, irritability, or becoming easily upset. A student will not experience all of these symptoms, usually just a couple. Hypoglycemia can occur at any time or any place. It is not always predictable or preventable. It's expected that even with good blood sugar control, a student with type 1 diabetes will experience 1 or 2 low blood sugars a week, sometimes a little more frequently and sometimes a little less. So always being prepared is the key. If a student complains of feeling low, feels unwell, or acts strangely, they need to check their blood sugar. If the number on the meter is below 4, they must immediately take the treatment of fast-acting sugar written in their plan.
When my blood sugar is low, I usually feel kind of shaky and my knees feel like jelly. Most times I know when my blood sugar is too low, but sometimes I can't tell, and one of my friends or a teacher will say to me, "Are you okay? Maybe you should test."
How are you feeling?
I'm feeling low.
Okay. Do you want to take out your blood testing monitor?
Yeah. I can usually check my blood sugar easily, but sometimes when my number is too low, it can take longer to get out my meter. Sometimes I get a bit confused. I know what I want to do, but it's hard for me. Sometimes I need help. Once I've checked if the reading on the meter is below 4.0, I'll drink the juice box that I keep in my low-kit. I usually feel better pretty quick, say 5 minutes. But if after 15 minutes I still don't feel better, then I'll check again to see if my blood sugar level has gone up above 4.0. If it's still too low, I'll take more juice and then I'll have a snack, like a granola bar, just to make sure my blood sugar stays up at a good level till the next time I eat. I always try to test when I feel low because sometimes I mix up the feelings of being low with actually being high. Sometimes I've checked my blood sugar and I've been surprised to see a high number instead of a low one.
So if the blood sugar level is below 4, the student must take their fast-acting sugar immediately. If the student looks like they're low and testing isn't possible, just treat as a low blood sugar anyway. This will ensure the safety of the student, even if the student wasn't actually low. When in doubt, ask the student to check. If checking isn't possible, treat as a low. Essentially, we want to get some fast-acting sugar into the student's bloodstream as quickly as possible to provide sufficient energy for the brain to function properly. Some examples of fast-acting sugar are 6 ounces of fruit juice or pop, not diet of course, 3 glucose tablets, or 5 lifesavers. It's important to understand that with hypoglycemia, a student who is low may not be aware of his or her condition. Their self-awareness is compromised by the fact that their blood sugar is low. They may not be able to think clearly, and they may not be able to recognize that they need help. This is when someone else needs to identify that the student needs assistance and help them take their fast-acting sugar. The student's hypoglycemic state makes them very vulnerable and in need of protection till their blood sugar has risen to a safe level. It's important not to leave the student alone during this time, not to ask them to walk anywhere or use stairs, because this will further deplete the already low level of sugar in their blood and could potentially make their symptoms worse. They could easily stumble or fall. They can quickly become confused or upset. If the level of sugar in the blood falls very low, the student will start to behave in very unusual ways. Symptoms of a very low blood sugar can include staggering, disorientation, and eventually unresponsiveness, unconsciousness, or seizuring. If the student is exhibiting symptoms of a very low blood sugar, it's unsafe to put anything in their mouth because they might not be able to swallow safely. So don't attempt to give them any kind of food or fluids by mouth. Simply place them on their side and call 911.
Wake up, Haley. Can you call 911?
We have an unconscious student with type 1 diabetes.
Stay with the student till the ambulance arrives and be sure to tell EMS that the student has type 1 diabetes. Hopefully this would be a very rare occurrence.
I've never had to call 911. There are usually early signs and symptoms of a low blood sugar so that it can be recognized and treated promptly before the student's level of consciousness becomes altered. Recognizing and responding to the signs and symptoms of hypoglycemia immediately is the key to preventing the more serious consequences of low blood sugar.
There are several things that can be done to help reduce the chances of a low blood sugar occurring, such as sticking to the usual classroom routine and eating meals and snacks at the same time every day. Food is like medicine to a child with type 1 diabetes, and certain foods must be eaten at scheduled times to balance with the injected insulin. So, make sure the student eats snacks and lunches on time. Make sure the student has sufficient time to eat all their food. Make sure that all of the snack or meal is eaten, so no trading with classmates and no saving food from one mealtime to another. All of these things will help keep blood sugar levels in a healthy range.
Having diabetes means I need to remember to eat my snacks and lunches at the right time. But sometimes I get distracted. It really helps if I have enough time to eat my food. And if I forget, my teacher can remind me that it's time to eat. I can eat the same food as everyone else. I just need to make sure I eat all the food my mom has prepared for me at each break.
Sticking to a routine really helps blood sugar stay within a healthy range at school and at home. Eating at the same time each day and taking exercise at the same time all help to keep blood sugars where they should be. It's so helpful when the teacher can let me know about a change in the class routine so I can adjust things to help prevent a low blood sugar from happening. Thanks for letting me know. That way I'll adjust her insulin and provide an extra snack for her to take with her to school.
Exercise is one of the things that often makes my blood sugar go low. It can happen when I'm in the middle of a gym class or when I'm out in the schoolyard playing tag. The best way I have found to stop going low is to drink a juice box before gym or make sure I eat my entire snack before going out for recess. At times I've had to stop during gym class because I felt shaky. So I quickly tested my blood sugar and took a juice box. I waited till I felt better, then I grabbed a granola bar before going back to class. Low blood sugars don't make me feel good. But if I have my tester and some juice, I can deal with it quickly and get on with having fun like everyone else.
Sometimes the students' classmates are actually the ones who are able to recognize when their friend is low, and they can go and get some help.
What exactly is type 1 diabetes?
Educating classmates helps to promote understanding among other students. Telling classmates what a low blood sugar is and what the student must do in order to treat their low blood sugar helps reduce teasing or complaining. Make sure the student's seated, have some juice there, and make sure you get a teacher, and they should check their blood sugar first.
Always being prepared and understanding that hypoglycemia can occur at any time and any place is the key to keeping the student safe. Allowing the student to test and treat whenever and wherever they feel unwell helps keep them safe and makes looking after their diabetes a little bit easier.
Having diabetes was hard at first, but now that I've had it for a while, it's easier and it doesn't bother me anymore.
Diabetes, it's not that hard, and if you take care of yourself, you can live a life like everyone else.
Thanks very much for taking the time to watch this important video. We hope that it will help you feel more comfortable supporting those students in your classroom with type 1 diabetes.